Yeah, hi guys, I'm Dr. Rajat, and with me I have Dr. Rajeshwari. She is practicing in Bahrain, and she spent 6 days of rotary endodontics trainings here, and just would like to know from you, Doc, how was your experience working here and working at a new era of rotary endodontics? How was it?
So I was very happy to be here. Actually, I came for my advanced rotary course, but I've got to see so many things, different branches of dentistry. I came for one, and you gave me many. And
it's always a pleasure. You are you are an excellent clinician who have touched every bit of it. You've touched everyone's heart with your dedication and with your work. I am so happy that what all patients that we gave you, you did your 100%. I think you did it with conviction and a lot of hard work. So what made you to join rotary endodontics training? I think we were in touch for a long time.
Yes, sir.
So
yes,
how did you think of joining a rotary endodontic course?
So I went through your sites, and I was really fascinated with the way different students were reciprocating, and I got to know the way of you teach and how you implement yourself in the practice. So when I came here also, I was very happy to see not only the treatment part, but how you generally, all aspects of dentistry. So that was really very exciting for me, and I would like to highlight that this clinic is like a museum of dentistry. You see different materials which are starting from first generation to
museum of dentistry, or something that I've never heard, but really I take it as a compliment.
It's really good because you can see different types of equipments, different type of materials, and everything for that matter. Because I've done other courses also. We are channelized to one particular, but here you're open to everything.
Yeah, open to everything, from working on tips and tapers to apical gauging to ultrasonics to
Implants, lasers, aesthetics. That's what I came for one, and I got to know about everything, and staffs were very cooperative.
We did a lot of.
I feel like my own house.
Yeah, yes, you worked here like your own, and
warm.
I think that is so fantastic to know. And I think
you are very approachable, sir. I should tell you that you are very approachable. Like
I make sure I just make sure that I am approachable all the time. But sometimes there are there are moments that I somehow but I always try to answer each and every bit of it. But still, I think 6 days went like 6 hours.
Yeah.
There is always a lot more to it.
Yeah.
But like I said, I always have told you that once I have just given you a push, you have to now. The concepts now, from rotary to ultrasonic to microscopically how to manage calcified canals. The way. For example, how to remove a crown automatically using of VAM keys, using of Pro Ultras, using of physics forceps, and how to make your how to do the preparation minimally invasive, and working on core build-up, working on orifice opener. So I think we were so happy that we were able to show you many cases. And you were able to do many cases on your own. Like you did a case of core build-up, post and core, and lot more to it. Yesterday you saw a surgery for zygomatic implants. I showed you the infravertebral foramen.
It was very interesting, very informative, and it was like, really, I'm looking forward for implants with you now.
So most welcome. I also would like to thank my team. We have worked for closely 10 hours every day for the last 7 to 8 days, and I think there is a lot more to it. There's a lot of hard work, and I think without the team is not possible.
Yes, sir.
I think it's a team effort, and I'm just so happy and thankful for her words. I think that drives us to work harder and work better for our patients. Like I always say that whenever you're working, you have to make sure that the way you treat patients, you have to have a spiritual contact. I think that is very emotional. You have to have that emotional touch with your patients. I think that bond is something that these days are missing. So let us not go into the commercial aspect or the financial aspect. Yes, we have to feel for the patients, because after all, they are your family. So it's like whosoever is sitting on your chair, you should feel that you are the one who is treating your own self, your father or your mother or your sister. I think that is missing these days, but I always make sure that we always feel that whatever we know, I always have shared everything that I know, and it is a continuous process. I'm also learning, and I just sharing every day, and getting to hear the feedbacks from you is icing on the cake. And I must say that you have touched.
Deserve it, sir. Really, you deserve it.
Thanks a lot.
So much.
All the best. Thank you.
Thank
Thank
you,
you.
sir.
Thank you.